Mr. Ahmed Norman Anis, who's the director or HR of the Riphah Group. He's a HR and OD specialist with 20 plus years of experience. He has a unique blend of both academic and corporate exposure. He's also a pioneer in revamping management trainee areas, hiring programs, etc. And he is also a very pioneered certain very innovative techniques in hiring, interviewing, etc. So let me request Mr. Ahmed, who's joining us from Pakistan and one of our very distinguished guests. Please go ahead, sir.
Thank you very much, Nitin, and I'm very much obliged on behalf of Riphah Group, and very warm welcome to our global friends from India, friends from Dubai, and at global levels. And I think I have learned a lot during the last hour and a half, and very much impressed by the quality of the speakers, and would like to collaborate further on these issues and challenges which are common in South Asia as well as obviously in this part of the world. Let me just introduce my own self. Thank you very much. You have introduced me. I'm the corporate director of Human Development Services and Director Strategy of Riphah Group. Let me just introduce you to the Riphah Group very briefly. Well, we are amongst the top 500 universities of Asia in the Asian ranking, in the QS ranking. And at the moment, Dr. Lee, can you move on to the next slide? At the moment, we are having over 7 hospitals and then over 40 colleges, a number of campuses across Pakistan, and as well as we are having footprints in UAE as well as Mauritius, and we are shortly going to open up our offices in Saudi Arabia and Turkey. Also exploring to open up a couple of more ventures in Central Asian states. Riphah is one of the fastest growing conglomerate, and we are having a sort of a classic combination actually of education and healthcare. In the last 1 year, we had a lot of challenges in terms of education as well as the healthcare, and we supported the nation, we supported the people in terms of the hospitals, in terms of treatments of the COVID patients. And I can share a very brief stats with you that on an annual basis, we roughly take care of more than 400,000 patients, in addition to over 18,000 students in over 25 disciplines across the country. And we are also into community services. We heavily invest our efforts and time and scholarships. And at the moment, we offer over 500 million rupees of scholarships on an annual basis to thousands of graduates. And we also support over 100,000 of patients on an annual basis in Pakistan. In the UAE, we are having one of the very rare distinction of a dental college at the moment, which is JCI as well as Canadian accredited. And that college is the only one, the first one in the entire GCC to have been accredited internationally by 2 very prestigious global bodies. In Mauritius, we do have a footprint, and we do have global faculty from as many as 8 to 10 countries with us. That's about the Riphah Group. It's ranked number 2 in terms of the medical education, and we are striving for excellence in medical education, in dental healthcare, and in obviously basic sciences and general arts and humanities. That's about the Riphah Group. Now, coming to the topic very briefly, because I and Dr. Lee will be sharing 10 minutes amongst us. Well, after the challenge we had, like all other nations of the globe, what we did was that we invoked the business continuation plan. And that's something very specific to the organization, that the BCP plan was actually to ensure that we continue our businesses and the HR without interruption. and without having problems to our patients as well as to our students. That's the twin sort of objectives we had for our customers, because our customer means the students as well as the patients. For the students, we had developed online modules, the online trainings, online platforms, and obviously we heavily used Teams, Zoom, and so on and so forth. For the patients, we established the virtual care, or a V-care, we call it, platforms, whereby the doctors and even the paramedics, they are available on virtual basis. And before that, at least in Pakistan, majority of the people, they believe on face-to-face interaction with the doctors and paramedics. For the first time, we have gone virtual, and I think it's a leap forward in our environment. At least what we were supposed to do in the next 5 years, we did it during the COVID times. Then we had a big challenge, obviously, to safeguard the medical community and as well as the paramedics from the COVID, and also to serve the people diligently and to the maximum, which is a humanity cause. And then we also tried our level best to ensure that the students, they don't suffer during this very testing times. And I'm very much impressed by the Sheikh Rashid University and my colleague, which short while ago he presented a case study of Dubai. And again, so we followed that footsteps, and we divided our entire team into three areas, basically the healthcare, the academics, and finally the management, and developed different kinds of policies, which I think my colleague Dr. Ali will present on this. Well, we identified being a private sector organization, even though we are a trust or a sort of non-for-profit organization, but still we are in the private sector. That financial stability was one of the biggest challenges which we faced during the COVID times. And I think during this testing times, the central bank of the country, they introduced a number of measures to stabilize the economy and ensure that the access to the capital was there for medium to big size companies like ours. And during this, I'm glad to share with you that we have over 2,600 employees, and we did not lay off any specific employee only because of the COVID. And also, we did not have the pay cut for any of the employee of the organization. And then the third challenge for the HR obviously was to adopt to the internal and external factors, and then train and tune the people on the new normal and the new realities. For that, what we did was that we introduced a total paperless and remote, I would say remotely available platforms of IT to introduce the web-based performance management systems. And the organization obviously runs on a key performance indicators, and everybody is assigned those KPIs. But in the present case, what we did was that we made some improvisations and introduced that on a web-based technological platform, whereby everybody could actually do, and on an online and real-time basis, their tasks and their KPIs, and then can assess their employees. Also, we introduced a number of policies like work from home, and Dr. Ali would present better on that. So I think in a nutshell, the fourth point is very important, that our top management, when we had the first meeting after the lockdown, we had long deliberations from the HR perspective, from the finance perspective, and the one thing was common in the theme, and that was the positivity and optimism. That we were quite positive, we were optimistic that we will survive this pandemic, or this kind of a challenge which the global community is facing. And the second important thing was the networking, and how can we learn from other nations, how can we learn from other areas. And I think we did fairly well in terms of keeping our students on track, in terms of servicing our patients. They are into lakhs hundreds of thousands of patients, thousands of students. Though I will definitely admit that the new normal was very challenging and not exactly like the previous normal. So we had to give up the meetings, face-to-face meetings, and we went on to adopt to the new reality of Teams and Zoom and technology and remote locations and then WhatsApp and so on. So I think as far as Riphah Group is concerned, or as far as we are concerned, we think that uh, that's from the God, and that's a God gifted, that resilience is inbuilt into the human system as well. So whenever there is a threat, there is also an opportunity. And I think the HR community of post COVID, I think they have a lot of things and lot of potential to perform, and they have a lot of things on their table. The most important learning from all this was to stay positive and optimistic. We had a lot of pressure on our financial stability and challenges, but we did not lay off the employees, and we continued believing that our business will return to the normal.